enter into Mrs. Jones's room, I'm going to gather my supplies. So I have my central catheter dressing change tray, extra set of sterile gloves, my CHG impregnated bio patch, and clean gloves. Alrighty. Good morning, Mrs. Jones. My name's Lindsay. I'm going to be your nurse today. Can I go ahead and verify your name and date of birth, please? Thank you. Can I also verify any known allergies, especially to the cleaning agent chlorhexidine, tape, or latex? No? Awesome. So today I'm going to be changing your central catheter dressing. So I see on your chart that you had this changed 7 days ago. Do you recall that? Yes? Do you have any concerns or questions? No? Awesome. Are you experiencing any pain or discomfort? No? Okay. I'm going to go ahead and help you get into a comfortable position. Alrighty, let me know if you have any pain or questions at all throughout this. I'm going to wash my hands. Don clean gloves. Grab my sandy cloth. And I'm going to wipe down my side station, making sure I get all the edges. Dispose of those. Discard my gloves. Wash my hands. Okay. And I want to make sure that I let this table dry for a full 2 minutes before I bring any of my supplies on. So the 2 minutes has passed, so I'm going to go ahead and get my table ready. So I'm going to bring over my clean gloves, my CHG bio patch, my sterile gloves, extra set, and my dressing change tray. Alrighty, I'm going to go ahead and wash my hands. I'm going to open up my tray. My hands are clean, so I'm going to go ahead and take out my sterile gloves and the mask. And due to COVID, Mrs. Jones is already wearing her mask as well as I am. Otherwise, I would be placing the mask on the patient at this time. Alrighty, so I'm going to go ahead and take the bio patch, open it, and drop it in. Alrighty, I'm going to wash my hands. I'm going to don clean gloves. Alrighty, Mrs. Jones. So what I'm going to be doing is taking off this existing dressing, cleaning the site, assessing it, and then replacing the dressing and tape as well. Okay? So before I begin, I'm going to ask you to please turn your head to the side to prevent any bacteria from coming into the site. We want to keep it as clean as possible. Any patient turns their head. Okay. Alright, I'm going to go ahead and start by taking off the tape. Okay. I'm going to assess the tubing, make sure that the cap is on tightly so no air comes in, make sure the lock is locked so no fluid comes out. Okay, I want to take my measuring tape and measure from the insertion site to the lock to make sure that it stays within those 4 inches the whole time. I'm going to stabilize the tube and start from the outer to the inner, pulling the dressing off. You're doing okay, Mrs. Jones? I know it's kind of sticky. Just let me know if you have any pain. Stabilizing the tube. Okay, good job. And I'm going to go ahead and take the bio patch off. Okay, I'm going to dispose of these. And now I'm going to assess the site, check for any signs of inflammation, swelling, redness, fluid. And the site looks clean, dry, and intact. I'm going to assess the tubing as well, check for any cracks or leakage, and it looks good. Making sure that that stays within the 4 inches from the lock to the insertion site. Alrighty, now I'm going to go ahead and discard my gloves. Wash my hands. I'm going to get my sterile gloves ready. sterile, I'm going to go ahead and take this and drop it into the garbage can. Alrighty, so now I'm just ready to move within my sterile tray. So I'm going to go ahead and get my tape ready, my bio pouch is in there. I'm going to grab my Tegaderm and get this ready, opening it up. Okay. I'm going to grab my chlorhexidine and crack it. Test it on the side, make sure that the fluid's coming out. Alright, Mrs. Jones, I'm going to ask that you continue to keep your head turned to the side. Use my left hand and grab the tube. And I'm going to go in a 2-inch window right around the site for the hospital policy. Make sure that I clean up the tubing. I'm going to let that dry for 30 to 60 seconds. I'm going to keep my hands in sterile and discard that. Alright, and once it's all dry, I'm going to go ahead and use my sterile hand to grab my bio patch. Use my left hand to grab the tubing. Still doing okay, Mrs. Jones? No pain? Okay, we're almost done. Okay. Use my right hand to grab the Tegaderm. Go ahead and place this on, making sure that there are no air bubbles, anywhere where there can be a leak or air can come in or out. Okay, I'm going to go ahead and remove the outer wrapper. Ready? I'm going to take this off. Write down my name, initials, date, and time. Okay, I'm going to place that on there. I'm going to get my tape. And tape just below the cap, away from the patient's face. Alright, once again, make sure that the caps are locked and this lock is locked so no air can come in or fluid can come out. Alrighty, Mrs. Jones, I'm going to go ahead and clean up my station. How are you doing? Good? Awesome. No pain, discomfort? Perfect. Let me know if you have any questions. Discard those. Take off my gloves. Perform hand hygiene. Okay, Mrs. Jones, you did very well. It's all done for you, okay? Let me know if you have any questions. I'll come back soon to check on you. And at this time, I will document initials, date, time, the assessment site, as well as patient tolerance to the procedure.